right, we're going to get right into the meat of the program. Lord have mercy. Dr. Tracy, I haven't seen you in a while.
Yes, it's been a while.
Yes, but you look beautiful as ever.
Thank you.
Your entourage, all of them look good. What's going on here?
What's going on is that I'm glad to be here, starting a new practice, decided to move out on my own.
Yes.
Stepping out on faith.
Yes.
And I'm super excited.
Yes. And the name of your new clinic is what?
Exclusively Skin.
Exclusively Skin.
Yes. Doesn't that sound nice?
Yes, it does. Why did you choose that name?
Because that's what we deal with. Exclusively skin issues. That is my passion. That's what I've done for the last 12 years. So I'm not just dealing with your issue of your dry skin. We may talk about what are the things that are keeping you up at night. How are you dealing with child care? So all of these things kind of play into your overall health. So we do discuss things that don't necessarily have to do with the skin, but will also help your overall health. And I think my patients appreciate that.
Let's get down to some of the things that you treat as far as skin is concerned. I know you treat keloids. What are some of the other things you treat?
Acne is probably one of the most common issues. And along with acne comes a lot of blemishes. So a lot of people will come in and say, I'm just here for these blemishes. I don't really care about the acne. But what they don't understand is that if we don't treat the primary cause, which is the acne, then they will continue to get these blemishes. So you can't just focus on one issue without really knowing what the primary issue is. So the most common reason why people will come into the office is because of blemishes. So dark marks or blemishes that they call it. Most people call it scarring. It's truly not scarring. So when you have dark spots, brown spots, in different complexions, it can even be a salmon color or red color, discoloration, it's not scarring because this is something that can be reversed with proper treatment.
So, doctor, you also treat hair problems also?
I do. I would say about 25% of my practice is hair loss. I mostly focus on women with hair loss, but I also have some men that I treat. You know, it's very upsetting when you have a female that's losing their hair. And so these appointments can be very long. They can be very emotional. But I'm aware of that, and I feel that I'm compassionate and caring, and I also get good results.
So, doctor, financing, when you go into your office, how does that work?
Well, I am on most insurances, and for my patients that saw me previously, I will still be on all the same insurance plans. I will also be able to take some insurance plans that I didn't take before if you're willing to go out of network. And as always, I always take self-pay patients. So most people think that if you don't have insurance that you can't go to the doctor. But we do make concessions for people who don't have insurance by giving you a 20% discount on our rates. So we make everything affordable. Also for the self-pay patients, if you are paying for your visits, I try to keep samples, so I keep a good relationship with my pharmaceutical reps so that the people who do not have insurance can get quality medications. One of the medications that I prescribe a lot costs $600 a month, and I can give that to patients because of my relationships that I have.
I like messing with Dr. Tracy. Who's on the phone line? Talk to me.
Hey, Tracy Ringo, I got 3 questions for you. Can you hear me okay?
Yes, I can hear you.
Where's your new office going to be?
My new office is in Garfield Heights off of Transportation Boulevard. The address is 9565 Midwest Avenue.
When's it going to open?
We are out about 6 to 8 weeks, so the construction is still ongoing. And so, you know, when you're dealing with construction companies, you're kind of at their mercy. And so right now I have a good team. So we're looking at about the beginning of March, first week of March to open.
Okay. That wasn't one of the 3. Here are the other 2 questions. Is there a cure for eczema?
Okay, so eczema can be controlled. For my patients, I hesitate in saying that because I want to say yes. A lot of people do grow out of eczema. But with my patients, if you come to me, and the first thing that I'll tell you, if you come to me at your worst, I will say with great confidence that you will never look like this again. This will be the last time that you will see your skin look this bad. because I'm going to teach you how to take care of your skin and recognize the signs when it's time to use your medicine. And most people will prescribe medications. They give you a bunch of scripts and they send you on your way. They don't explain your prescriptions. They don't tell you things that you can do environmentally that can help control those symptoms. And so I do take the time. I do spend a lot of time with you that first visit so that you understand your disease and can control it.
The reason I ask that is because I know people that never had eczema problems as kids, but now they have eczema problems now and they're in their 30s. And that's why I asked that question, because I thought maybe it was something that could be reversed because it's something that wasn't natural in the body all along. But here's one question for me. This is for me. I noticed that I've lost hair on my shins and on my forearms, and I didn't think it was a big deal at first until it started getting a little bit thinner than normal. Is that a problem that I would bring to you as a dermatologist?
You could bring that problem to me, and for most people, probably about 75% of the people will experience hair loss. It can be on any surface, but of course when it's on the scalp or in the eyebrow area is when we're going to notice it the most. But it can be on the shins, the legs, the arms, and we may not even notice that there's a patch of hair missing, but that's absolutely something that you would bring to me.
Okay, cool. I'll talk with you. I'll probably be talking with you. All right, bye.
I look forward to it.
All right, so if he'll probably be talking to you,
Yes.
what is your phone number, and at that particular time, how would the listeners be able to reach you?
Okay, my phone number is 216-508-6500. And you can actually call this number right now. So once you call the number, your name and phone number will be captured, and within the next week or two, my receptionist will be calling to get all your information and put you in the system so that we can start scheduling you for appointments. I treat all origins. I also do a lot of skin cancer screening. So I do treat all types of people, all skin types. So probably about 25% is skin cancer screening. We also were taught, as African Americans, that we don't need to wear sunscreen. And so that's one of the educational things that I provide for my patients. I also give them samples of sunscreen to try, because most of the sunscreens that we will come across will turn our skin purple. And so there's a special sunscreen that I give to my patients that will not do this and will also give them great protection. So the first thing when I say, are you wearing sunscreen? They look at me like, why do I need that? Well, one, you want to maintain your complexion. So if you want to maintain your complexion, you absolutely have to use your sunscreen. And we as African Americans can also get skin cancer, which we did, most people don't believe.
Yes.
Yeah, one of the major things is that I tell everybody is that you should check your feet. And so when you come in for a skin check, you're taking off all your clothes. We'll keep you covered. You're going to take off everything, and I'm going to check in between your toes and the bottom of your feet in places that you wouldn't think to look.
No doubt about it. Yes.
From our text line at 216-804-7462, 314 area code St. John, Missouri. Got to say hello to the electrician out there, and he definitely wanted to make sure that we ask about older people as well as moles. Is there a need? Does that fit into your category? And on the other one, somebody from 216 area code wanted to know about, is there a major difference between ethnicity and skin problems?
Okay. So for the first one, moles, yes, I do removals of benign moles or papillomas, also what we call seborrheic keratosis, which are kind of like a superficial crusty lesion that can just be unsightly for some people. I do remove those. Most of those are a cosmetic treatment, so that insurance will not cover most of those. But yes, you can actually come and have an evaluation to have those removed. The reason why insurance doesn't cover them is because it's not going to hurt you to have a mole. It just may be in a place where you don't like it. But if it's issues with the mole, such as it's bleeding or it's grown in size or you're having changes, then we can take a sample of it and insurance will cover that.
So doctor, you cover about everything as far as the skin is concerned.
Yes, everything on the outside. So if it's a hair issue, skin issue, nails, toenails, fingernails. Also do a lot of genital exams for different issues that can happen in the groin area.
So is your slogan still the skin you're in.
Love the skin you're in.
Love the skin you're in.
Yes, that is still my slogan because that's what I want everybody to be able to do, is to love the skin they're in.
Dr. Tracy, it looked like you love the skin you're in.
I do. I'm blessed.
And your sister and everybody else. The skin is beautiful, so it's a beautiful thing. Now, Dr. Tracy, my pet peeve is keloids. What can you do for them?
So for keloids, most people want to have them removed, and they come in and saying, it's unsightly, I want it removed, can you take it off? The reason why you have the keloid is from an insult to the skin. So it can be a scratch, it can be a scalpel,
right.
It doesn't have to be a scalpel. Most people think that it wasn't a surgical scalpel that created this. Why do I have a keloid? So you can actually get keloids from just picking a hair bump on your beard.
That's right.
You can get it from picking acne. So I always tell people, never pick your skin.
Yes.
We as African Americans, and to kind of answer that question that was asked through text, yes, we as African Americans are more predisposed to keloids. So ethnicity, you would see that more prevalent in African American community. What I do for treatment is I do injections. And most people will say, well, I had the keloid removed and it came back. Because when they go somewhere, they have the keloid removed, but they don't have the proper follow-up treatment to keep it from coming back. And usually I'm following up with this person for about a year to a year and a half after the keloid removal. But most of the time when I'm dealing with keloids, it doesn't even have to be removed. The serial injections, and I say serial because we're doing this once a month, the interval can increase as we start to treat and the keloid responds. So you're coming every 4 weeks. Then it can be every 6 weeks, every 8 weeks, every 3 months as the keloid starts to flatten out. So I'm treating it, and a lot of times we don't have to make another incision to remove it. The actual medicine that I'm injecting will shrink the keloid.
So, because that was one of my biggest problems was if we cut it off, the incision is going to come back maybe even worse. That was a fear of mine. So you're saying that you have these injections that you use that can shrink it.
Yeah, so the injections will actually shrink it. It decreases the insult to the area that's already inflamed, and I get very good results. Very good results with it. My patients are very pleased. That a lot of times, some of the issues when you go to other offices may be minimized. So they'll say, oh, you're just worried about that? So when you come, I feel like if you took the time to come to my office because of that issue, then it's important enough for me to address. And so no issue is too small. No question is not smart.
Mm-hmm.
Because that's what we're here for.
Mm-hmm.
We're here for all your questions and all your concerns. If you have an area that you're not sure if this is something I should be concerned about, that's when you make an appointment. You get the appointment so that you know that she says this is something I don't have to worry about. And if I look at it and say it's suspicious, we'll get a sample of it that very day and send it off so that we'll know within a week if this is something that requires further treatment. I also am on staff at both Cleveland Clinic and University Hospital so that if you have insurance plans through those hospitals, you can still come to me and not be considered out of network, even though I'm in private practice.
So you were with University Hospital and Cleveland Clinic?
Correct.
Girl, I don't know. I'm amazed about you every time I talk to you. Information that I didn't know. You know, so it's a pleasure to talk to you, Dr. Tracy Ringo, and it is a passion of mine to have you come on because I know that so many people suffer from skin problems, and it really bothers them. And so to have you on, and I'm very sincere about this, Dr. Tracy, I realize that you could be anywhere in the United States or overseas, but you choose the people in Cleveland and surrounding communities in the suburbs. Yes. You choose us for this world-renowned practice that you have. And as long as I can, and I believe in you sincerely, I'm going to always tell my listeners that Dr. Tracy say, be what?
Love the skin you're in.
Love the skin you're in. Lord have mercy.